As drowning continues to claim lives across Ghana, with at least 9 people reported dead this week on the Volta River, questions are growing over what more can be done to stem the tide. In this special report, Metro TV's Asamoah examines a new national lifeguard intervention aimed at preventing further loss of life and strengthening water safety systems across the country.
Every year in Ghana, an estimated 1,400 lives are lost to drowning, a silent crisis unfolding across beaches, rivers, and even homes. For many, it is sudden. For families, it is devastating.
One story that I can readily remember is the Municipal Chief Executive of Koliklote Municipal Assembly, who said at his younger age, he went to the beach with the friends and returned home without one of them.
But now, a coordinated national effort is emerging, one that aims to turn the tide.
And this intervention is novel in nature, since it is a model that we are testing in a way that we want key stakeholders in the country, especially the municipal assemblies, to support and ensure sustainability. So in this intervention, what we are doing that, the funding is supporting the training and deployment of these lifeguards, and also buying equipment to support the work of the lifeguards on the beaches.
Drowning in Ghana happens in many forms: along coastal shores, inland water transport routes, recreational areas, and even within domestic spaces. Children and vulnerable groups are often the most affected. In response, government agencies, researchers, and emergency services have come together under a unified vision to treat drowning not just as an accident, but as a national public safety priority.
As part of the project, what we have done is to bring stakeholders together. Drowning is seen as a multi-sectorial discipline. So to approach and to prevent drowning, it needs several key stakeholders. So in order to work towards this drowning prevention, we form what we are calling it National Coordination Board. And this board is to set standards. For example, we had a meeting with the National Coordination Board, which is made up of Ghana Fire Service, Ghana Maritime Authority, Ghana Tourism Authority, the Ghana Police Service, the Ghana Navy, that came, and the National Disaster Management Organization, NADMO. They form the National Coordination Board. And we, the academic institution, the Kwame Nkrumah University of Science and Technology, and the Johns Hopkins University School of Public Health, we came together as an academic institution to be generating the evidence to support the work of the National Coordination Board. But in terms of stewardship, it is the National Coordination Board who is supposed to be setting the standards, looking at the policy direction, and how this whole drowning prevention initiative should be done or should be conducted in the country.
A national coordination board has been established to drive policy, enforcement, and rescue operations across the country. At the heart of the intervention is a bold solution: the training and deployment of professional lifeguards in high-risk areas.
We don't have much skills. We don't know much about the life saving, but we thank God that this opportunity has come for us, that we got training like this, that we know more skills about the life saving. So for me right now, when somebody is drowning, I know how to save in life.
The program is being led by public health experts in collaboration with international research institutions, bringing global expertise to a local crisis.
And we have an effort that we have started here in Ghana to work with the Ghana government and academic partners to prevent drowning deaths. The reason that we are working in Ghana is that the drowning rate in Ghana is at least twice as high as what the rate of drowning is in the rest of the world. And that made Ghana a very attractive place to start this initiative that we do here, the Lifeguard Initiative.
Local authorities are playing a crucial role, working directly with communities to ensure the sustainability of the intervention. The project also strengthens emergency response systems, linking the Ghana National Fire Service, National Ambulance Service, and the Ghana Navy in coordinated rescue operations. Enforcement and surveillance are being enhanced through collaboration with the police and maritime authorities.
And the lifeguard, they have to have it. They have to train people to see the beach. They cannot helping the people always, then people are drunken and all those things. It's not fair.
Ghana's efforts align with global initiatives, including World Drowning Prevention Day, placing the country on the map in the fight against preventable water death.
But what has pleased me, I think, the most is the eagerness of the stakeholders. And by that I mean ministries, Ministry of Interior with the Ghana Fire Service and the police, NADMO, others such as the Tourism Authority, which has some legislation for tourist beaches, and many of the lifeguards that would work at a tourist beach, like at Labadi, would be regulated by the Tourist Authority. So that's an example of other ministries that would be involved. Also the academic partners, the municipal assemblies in the communities, like fishermen associations and others, have been very eager to see something done about drowning.
On April 14, 2026, the Drowning Prevention Lifeguard Intervention Project will be officially launched, a defining moment in Ghana's public safety journey. From tragedy to transformation, Ghana is taking decisive steps to protect its people, because drowning is preventable, and every life saved